Two. Hello, everyone. I am so excited to have you here today, but I am also super excited to have my very good friend, Dr. Mario Fucinari, here with us today. This is a man who is working in the trenches every single day in his practice, just like many of you. He's been training doctors and staff for over 20 years. Um, He's a graduate of Wayne State University in Detroit, and he received his doctorate of chiropractic degree from Palmer College of Chiropractic in 1986. In 1998 and 2003, he received the President's Award from the Illinois Chiropractic Society for his work with education and training, and recently received Chiropractor of the Year from the Illinois Chiropractic Society as well. He also has an amazing following on Facebook with AskMario.com. And let me just tell you, I have the tremendous blessing of knowing so many incredible minds within the chiropractic profession. And whenever I have a question that I don't know, they're easily accessible. But I will tell you that much probably to the dismay of Dr. Mario himself is that he is one of those that I lean on so much when it comes to questions regarding the financials in a practice, when it comes to coding, when it comes to compliance. Really, this is a man. It's like a one-stop shop for any and every question that I ever have regarding how things are going in a chiropractic office. So it is always an incredible pleasure to be able to have him here on our webinar series. And even better, I am so looking forward to spending some time with him in New York at the upcoming New York Chiropractic Council annual convention, where we'll both be speaking to chiropractic assistants in the state of New York. He'll also be sharing his wisdom with the doctors of chiropractic there as well. So Dr. Mario, thank you so much for being here today.
Well, thank you, Christy. After that introduction, thank you, folks. I might as well stop now, because anything I go after this, I have a lot to live up for. So it's great to be with everybody again here today. And as Christy gave you the introduction here, I'm currently in practice in Decatur, Illinois, and have a very busy practice. And there's myself and another doctor, and we actually have a preceptor here as well, and we're keeping busy. And the reason why I'm telling you that is because I know how it is, and there's a lot of changes coming up here. Keep in mind, and everybody, and I know I'm going to tell, we have staff, probably doctors, billers on this call here. There's many people on this call. So I'm going to give you some notes. I would highly recommend you have a pad of paper, and so you can write down tidbits as I give it to you. And the first one I'll give you is that changes are coming up. In fact, October 1st, we have some ICD-10 code changes. And keep in mind that ICD, which are diagnosis codes, those change. The fiscal year for ICD is October 1 to September 30th. So October 1, we have new codes going into effect. And if you're not familiar, I have a publication of the top 100 ICD-10 codes for chiropractors available at AskMario.com. But in there, I constantly am revamping the coding. Of course, LCD, which are the policies with Medicare, and even Blue Cross. Blue Cross just recently changed their policy as well. And so these policies and how they affect us in practice, you can look up those policies if you want, or as Christy mentioned here, and this is not a sell job here. All it is I teach all over. I teach for ChiroHealthUSA, for Foot Levelers, MCMIC, and so rather than answering emails, I get the word out, and you go to Facebook.com, but make sure you do the /AskMario, so Facebook.com/AskMario, and then just like me, if you go into that settings wheel, you can actually put it in notifications. So anytime I post, I don't post junk there. When I post something, then it'll come to your email. And it's kind of like if you said, Mario, keep me updated on any changes, that's how I do it, okay? All right. So, you know, as we go on here, let me first of all just get real with everybody here. And you know, it's hard for the doctors, and I'm going to address that. And we're going to talk about financial consultation. And you know, as a doctor, we all know typically how to do a consultation unless you're just starting off in practice. But I want to talk about the financial aspect and also reported findings and how to do this. Nowhere else are expenses going up while reimbursements going down. And I understand that. I just had a PPO that we were in, and they actually lowered their rate down to $19 reimbursement for manipulation. And my wife, she does our insurance, and she's a certified professional coder. She called up the insurance company and said, your rate of reimbursement is lower than Medicare. And they said, yeah, and that's exactly what they said. And she said, well, if we accept your rate, Medicare always has to be the lowest, which means we have to lower our Medicare rates as well. And they said, yep, that's what you'll have to do. And we said, no, instead we're going to get out of your PPO. And so the key is we're all being affected here, and I'm going to kind of address that here today. And, you know, I'll just start off by saying to everybody out there who's frustrated with, you know, keep making patients keep their appointments, paying the bills, and making sure they pay their bills, I understand, and I just tell you, you know, just number one, stay strong. And that's why I put the slide in there, because I was thinking, just stay strong. And let's talk about this a little bit. And I'm going to look at this from different aspects and make you think a little bit, and then we'll give you some solutions too. First of all, you know, with insurance itself and these insurance companies. Now, insurance companies, you know, doctors say to me, you know, patients come in and they can hardly walk, and they're throwing away their canes and their walkers, and hallelujah, you know, they're dancing in the streets, you know, whatever. But insurance companies don't care about that. What do insurance companies care about? Making money. And something that most people out there don't realize is this fact here. Insurance companies are getting paid in both pockets. And by that, I mean that what happens is an insurance company will cover any bills, any claims that come in. And so when they, for each state, what they do is they go to the insurance commissioner and they said, we are covering X amount of lives. So each person is a life. So you know, we're taking care of, you know, 180,000 lives. And in order to cover the claims coming in, this is how much we're paying out. So we need to charge this amount for our premiums. And so they show the state insurance commissioner the information, and they said approved. But what they don't show is that they're paying the claim, but then a different division within the insurance company is actually doing recoupment. And so they're getting some of that money back. Do you understand? They're getting paid on the claims they pay, but then they get money back from those claims, and so they get that money back that they are telling the state that they paid. This has been shown in lawsuits in the past with different various insurance companies. But the key is that the premiums are going up since 2013. In this article right here, and this is getting a little dated, May 23rd, 2017, but it shows that the average premium has doubled from 2013 to 2017. In some states such as Alaska, Alabama, and Oklahoma, the premiums have actually tripled. You know, I've got good insurance, and we pay a lot, my wife and I, a lot of money for Blue Cross, but I've got a $7,000 deductible. And so the plan that the patient has, and this is what I want to explain, especially to the staff, but doctors too, is keep in mind it is not our responsibility to make sure they have good coverage. Let me say that again. It is not our responsibility to make sure the patient has proper coverage. The patient buys an insurance policy. Here's just an example, and this is Blue Cross's here, but depending on the plan they buy, it's kind of like when you go and you say, I want to buy a new vehicle, all right? Well, I want, air conditioning, I want leather seats, I want power steering, power brakes, but I also want satellite radio, and I want where it parks the car for me, and all those extras you got to pay for. And the patient decides based on the menu what kind of plan they want. And even here, where you'll see, like in Blue Cross Preferred Bronze PPO, you have a $5,000 deductible, $6,500, $6,750, $7,000, and up here, depending on their deductible and what the coverage is. And so when the patient presents that insurance card to you, the staff and or the doctor here, the patient says, this is the policy I bought, see? And so those policy premiums are going up higher and higher. In fact, for 2018 here, the Kaiser Family Foundation, which that foundation reported that even for a bronze plan, the premiums have risen 18%, silver 32%, and gold 18%. So the premiums are going up and the coverage is going down. Again, they're getting paid both pockets, aren't they? You see? On the other hand, we have the patient. And generations, I'm seeing multiple. I just had a patient yesterday who started with us who's just a couple months old all the way up to a 90-year-old, okay? So I have different generations of patients, and the different generations, they will think of insurance differently. Obviously, a minor child who's covered under the parent's insurance plan doesn't think about insurance, but nowadays, even the young adults up until the age of 26 could be on their parents' insurance. And since they're on their parents' insurance, they could care less if they are covered or not, or what the coverage is. Send the bill to my mom. You see, meanwhile, they want to come in over and over again. There was an interesting article that I came across here, and this is from The Atlantic. This was May of 2016, but it's called The Secret Shame of Middle-Class Americans. If you want to look this up online, it's very, very interesting, I think, to put it in perspective of how patients are. Patients come here and literally they're living paycheck to paycheck. In the study, they said that the study asked individuals whether they could come up with $2,000 within 30 days for an unanticipated expense. And they found that about 1/4 could not, and another 19% could do so only if they pawn some items at the pawn shop, which means that almost 50% of people, when asked in the study, couldn't come up with an emergency expense. And I teach at colleges and I teach on the road a lot, as I said, but the new students, they think, oh, I'm just going to have a cash practice. Well, number one, understand that you cannot see a Medicare patient and have a cash practice. It's a hybrid practice. And doctors are mistaken. In fact, just recently, Noridian put out an article about opting out of Medicare. And so I had some doctors from Oregon, I had some doctors from Arizona, and they said, oh, finally, we can opt out of Medicare. But you see, it's like you don't read the whole article. And the article said, you can opt out of Medicare if you fill out this affidavit. And then on page 2, it said the following providers cannot opt out of Medicare. And those were the occupational therapist, physical therapist, and chiropractors. We cannot opt out of Medicare. You cannot see a Medicare patient, but you can't opt out of Medicare. Okay, so I want to make sure that's on the table. And others, they say, I'm going to do cash. Well, patients, yes, you see them, at restaurants, and they're, here you are ordering, chicken tenders, and they got the porterhouse steak, right? And those are the same people that tell you they can't afford to come in for your care. 78% of full-time workers said they live paycheck to paycheck. And in fact, there was in the study, it showed that even people that are making over $100,000 per year, about 20% of them said they are living paycheck to paycheck. And so it depends on what part of the country. $100,000 in parts of like Decatur, Illinois, goes a lot further than in San Diego, California. Okay, and so those patients, when they come in, the patient expects their insurance is good insurance. And especially, how many times have you heard, as I have, where a Medicare patient says, if Medicare doesn't cover it, I don't want it. Well, unfortunately, in a chiropractic office, Medicare covers spinal manipulation, nothing else. You can't charge for heat or ice with most insurances nowadays, okay? But, the patient, it's generational. And again, as I said, the young adults, they're on their parents' insurance. The other, they're 40-year-olds, they're living paycheck to paycheck, and they don't want to be compliant, or they have a huge deductible. And especially if you are out of network, and I just had a patient come in with Coventry insurance, and I'm an out-of-network doctor with Coventry, she's got a $20,000 deductible. And she goes, oh my gosh, and I said, well, there are some options for you, and that's what I'm going to talk about right now. And so when you are doing a consultation on a patient, you mark this down here, and this webinar will be archived for you too. There's certain questions you want to answer. Now, when I say you, I mean the staff and the doctor. And in my office, and what I'm recommending to all of you, patients have a tendency to only listen to what they want to hear and only remember what they want to remember. And so repetition is a good way. And I will tell you, in my office, our policy is that when we bring that, let's say a new patient, just to make it easy, a new patient back for consultation, the staff will tell them what their insurance coverage is. And then when I come in there, I will talk to them, about their condition, and then I go over the financial aspect. When they come in for report of findings, I go over it again, and then my staff goes over it. So by the time the patient has their first adjustment, the end of that session, they will have been advised of their coverage 4 separate times. And so hopefully, I still have some patients, nobody told me that, dream on. So I'm going to give you we're going to go over some scenarios here, but in consultation, and again, I'm not talking about Medicare, I'm talking about all care. I'm not talking about the cash patients, I'm talking about all patients. And so you treat them all the same. And when a patient comes in, the first thing they want to know is, can you help? Now, the doctor part of us, we're going to go through the chief complaint and then the history of present illness, review of systems and family history and so forth. But once you analyze everything, what they want to know is, am I in the right place? And so, assure them, number one, can you help? And what I say to my patient, and the script for that, if you will, is that, first of all, and I just come right out, I say, you are in the right place. And me personally, I've been in practice 31 years. I have seen this often, and I know it's not commonplace for you, but we see that in our office and have had very good success. Okay, staff, keep in mind, you are the ambassadors. You're the cheerleaders, if you will. You're the support group for the doctor. And when patients call and say, I don't know if he can help arm pain coming from my neck. Yes, the doctor sees many of these types of cases. So number one, I do believe that I can help you. You don't guarantee it. You don't say I can, I can help you. I understand. I've seen this before, and I believe I can help you. Okay. Number two, I've treated this before, and I have seen hundreds of this. I had a patient come in. It was actually an infant, 5 weeks old, and the infant has torticollis. Well, I've actually seen many patients, young infants with torticollis. And so I advised the mother, but the mother had heard from someone else about that I treat this as well. Okay, so you want to let them know, that this is not unique to your office here. But how long will it take to heal? And so I give them the short and the long-term goals. Number one, give me 2 weeks, you should be feeling better. You're not going to be completely well at the end of the 2 weeks. And in your case here, because you've had this for such a long period of time, you have arthritis or whatever it might be, then you tell them, it might take several months. Everyone heals differently. Okay, but you should feel relief fairly quickly within 2 weeks. Right? And then number four, what are the office hours? Because if a patient said, like our office hours are from 9 a.m. to 6 p.m. If you say, what hours do you work? Oh, I work 9 a.m. to 6 p.m. All right, so that may be a difficult situation when our hours coincide. So now, are you able to have flexible hours? Can you perhaps come in, right at 9 o'clock and then leave after that? Or a lot of our patients, they come in at 11:45 and make it as part of their lunch hour. Okay, and so you give them the option too. And then the ultimate question, which is really the reason for this webinar, is how much does this cost? Okay, now when you talk about how much it costs, we'll go through that, but you want to be careful that you're not implying a contract. All right, which means you don't state in, even insurance companies, when you call for benefits, they say benefits are not guaranteed, because it just depends on the modifiers you're using. It depends on if you're doing trigger point therapy and manipulation at the same time, whatever it might be. Now remember, you're reinforcing it on consultation. Usually I'll do a report of findings the next day. I like doing that because it gives me time to analyze all the information. So when the patient comes in, now that I've analyzed everything and they know I'm going to give them some concrete answers. So we go through what's wrong, and you explain to the patient, and I like to make it visual. Number one, most people are visual beings, and so your spine's been bent like a tree has been bent by the wind, or you have a rusty hinge joint with arthritis, whatever it might be, or you have a pinched nerve. And I know that's being simplistic, but people need to know it's simplistic. Okay. Number two, can you help again? All right. So now that you have all the facts, doctor, can you actually help me? And then number three, what are you going to do? All right. So, and I actually had a patient this morning. She's terrified of a chiropractor, but her coworker said, I had the same thing. She went to her family doctor, and the family doctor said, have you considered seeing a chiropractor? And she thought, you know what, everyone keeps telling me, go see a chiropractor, so she came to see me. And so she's terrified, and I told her, what we're going to do, and I explained how, we're going to be very gentle. I do osseous adjustment. I use my hands. I don't do instruments like activator too much, but there's nothing wrong with that. Just explain to them what you're going to do, okay, and when you're going to do that as well. And we usually will give them their first treatment after their report of findings. Will it hurt? Keep in mind, informed consent. Keep in mind that the most common side effect from a manipulation is muscle pain. And so, I'll tell them, it may feel like you worked out. You're not going to have more severe pain. But depending on, in the case here, she had cervical neuritis, a pinched nerve in the neck. She's been using heat, and she's been doing that for a month. Well, it's not going to feel wonderful when I do therapy, but use ice and everything else. Okay. Then how many treatments will it take? And so you give them your treatment plan. And keep in mind, nowadays, whether it's insurance or not, evidence-based practice is that you reevaluate your patient that's under active care every 30 days. And so, I'm going to see you 3 times a week for 3 weeks, then we're going to do a reevaluation. Then, of course, the last one, which is how much. So when you are asked how much does it cost, all right, this is the script, okay? And whether they have, if they have insurance, okay, you don't give them a contract. You don't say your insurance covers this, because that implies a contract. Instead, you will say, according to your insurance carrier, ... So according to your insurance carrier, you have a $7,000 deductible. It says here you still have $6,000 of that to meet. After you meet that $6,000, then you have treatment. Now, I had a patient the other day who gets 80 treatments per year. That's awesome insurance. But I told her it's not going to take 80 treatments. If I see you 80 times the rest of this year, then you'll have to come over for Thanksgiving dinner. I got to, buy you a Christmas gift. And she laughed. But what that did was it gave her hope that it's not going to be forever and ever and ever. Okay? And so that's here. How much does it cost that doctors get in trouble? Because here it's where you don't want, it's like, I know I can treat you. I know I can help you. I need you as a patient. No, you don't need them as a patient. They need you as the doctor. Sometimes the doctor wants the patient more so than the patient wants the doctor, okay? And so here, this is where the doctor starts to get, they go haywire. And doctors, in my office, I have what we call the 10-second rule. Which means when I go to the front desk, I got 10 seconds and I better get the heck out. Because anytime I'm there longer, I'm going to say something that is going to get me in trouble. I'm going to do something that's going to get me in trouble, and I have no business being in that part of the office, right? And so, doctors, they want to help people, and you're offering discounts, or you don't collect the copay or the deductible. Keep in mind, the patient, has a contract with the insurance company. The insurance company said, we will cover 80% of these services after you meet your deductible, and you have to pay a copay. If they don't pay the copay or the deductible, then the insurance company doesn't have to pay on their part either. In other words, if I have 80% coverage, whatever the doctor is charging minus PPO reductions, then you have to abide by those aspects of the contract. The doctor starts to make side deals. Then pretty soon it's like, what did I say? All right. And I will tell you, I'm certified in compliance, and I help doctors when, hopefully when they're not in trouble, but I help them when they're in trouble too. That's what I do. And I just got contacted, was contacted by a doctor and said, I'm not having any troubles. I want to make sure I'm doing things right. Will you look at my records? And that's what I do, is I audit records. We look at the financial aspect as well as the clinical aspect here to make sure they're doing fine. And I asked them, what are your accounts receivables? I had one doctor told me over $900,000 in accounts receivables. What does that mean? It means the insurance companies are not paying him, and either that or he's doing services for free. Okay? It turns out he's taking only what the insurance companies pay. Well, the insurance companies they're not paying well. I mean, we already established that. Or do you have a clearinghouse that gets a percentage of what you bill, whether you get paid or not? If it went to their deductible, the clearinghouse is still doing better than the doctor because the clearinghouse got paid, the doctor didn't. And so it's hard to keep stats of accounts receivables. Look at your 90-day accounts receivables. Do an aging report and look how much of it is 90 days or older. How much of it is 6 months or older? How much of it is 1 year or older? Okay? If you have a great deal, if like in my office here, I know our accounts receivable is about 20 to 30,000, depending on the state, the part of the year we're in. Well, that's what the patient owes us, or we're still waiting for insurance to pay, like on a PI case, personal injury. But it should never be 900,000, that's for sure. Okay, and so that's where ChiroHealthUSA comes in, because if a patient has a real high deductible, then their insurance may be deemed worthless. Do you ever notice that patients tend to come in the fall more than they do in January and February? And that's because January and February, the credit card bills are coming in from all their Christmas shopping. They bought the 60-inch TV, high-def TV, and now they got to actually pay for it. But the problem is they don't use their insurance either, and now they come in later in the year, and maybe they still have $6,000 worth of deductible to meet. And if it's October, there's no way, unless they're seeing another doctor, they're going to meet that $6,000. So that's where I personally, and script-wise here, I will tell them, have you heard of ChiroHealthUSA? Now, many of them don't, and I just tell them, I don't get paid. Me, the doctor, I don't get paid from ChiroHealthUSA. I don't make any money off of it. What I am doing is my office has been accredited with ChiroHealthUSA. How do you get accredited with ChiroHealthUSA? Well, number one, they go over your fee schedule with you and help you to make the discounts that you are already giving, to make those legal. You see, they're not lawyers, but what they want to do is they want to make it compliant. Is a good word for that. Okay, and so they will talk to you as long as you're not, going past or under the Medicare rate. Okay, and so keep in mind you cannot have a dual fee schedule, correct? But so why is ChiroHealthUSA their network discount? Well, the rest of the statement is you cannot have a dual fee schedule unless it's under managed care. This is a managed care program. It's an option for those patients that don't have any insurance coverage, or if they have inadequate insurance. In other words, I will never meet my $6,000 deductible that I still have to meet. Okay, so in lieu of, instead of filing with your insurance, now we will have you can go on ChiroHealthUSA. Now, it's not a time of service discount, but what it is a managed care. And there's some personal injury insurances that say if you offer discounts to certain people, then you have to offer it to ours. And it's like, wait a second, those people are ChiroHealthUSA managed care contracts. And you see, it is a contractual network discount. And then also, birds of the feather flock together. They will tell their friends. They go, oh, I went to the chiropractor, and the chiropractor, and there's actually one in my city here, the chiropractor says, you want the $4,000 or the $8,000 contract? Okay, and they run out of there, and they come to me, and I tell them, have you heard of ChiroHealthUSA? This is the best way to do that. So, it's not a cash discount, and it's not a way to opt out of Medicare. ChiroHealthUSA will take care of non-covered services. Now, a covered service in Medicare is the spinal manipulation. So if you are doing maintenance or wellness care, you can collect your regular fees, or you can give them the Medicare discounted fee. Let me say that again. If you're doing spinal manipulation, wellness care, you can collect the your regular fee or the Medicare discounted fee. But for other services such as exam, x-ray, even their therapies, all right, you can offer a contractual discount through ChiroHealthUSA. And again, it's not a time of service discount because this is under contract. The patient pays $49 for the year, so it's their contract. They can take that card if they move. They can go to another ChiroHealthUSA network doctor as well. Okay. Even if you were to give a time of service discount, did you know that the Office of Inspector General said that 5 to 15% is appropriate for a time of service discount? No more than that. If you're giving 30, 50% discount, that may be deemed to be an inducement as well. Okay, and so ChiroHealthUSA eliminates the issues of that dual fee schedule, which is an anti-kickback statute violation. And you have your normal fee. If a PI case, personal injury, or a work comp case comes in, you have your normal fee. That's typically your PI case. But if they are under contractual obligation, Blue Cross PPO as an example, Medicare as an example, ChiroHealthUSA as an example, then they get those discounts. And the nice thing is with ChiroHealthUSA, you set up your fee schedule. You want to make it legal, not give away the whole farm, but you want to make that legal as well. Okay? So when it comes to financial policies, your policy, and I'm going to give you this, take a picture of it, whatever, the only time we offer a discount is when it's required by mandate, such as a PPO, or by contractual agreement, or a documented hardship case. Now, depending on who you read, I've read through the American Chiropractic Association that you're supposed to look at their tax returns to determine if they are a hardship case. Do you think hospitals do that? Absolutely. That's why they have social workers. Okay, and so those, ChiroHealthUSA here, you are giving them options for the financial report of findings. And here's a script. This comes from ChiroHealthUSA. I'm not going to read you the whole script here, but Mrs. Jones, the doctor, has recommended 30 treatments for your care. It appears that your insurance coverage is blank. All right. Now, have you heard of ChiroHealthUSA? No, I haven't. And then you explain to them. We are really turning lemons, if you will, to lemonade. Okay? And keep in mind, in Medicare, you cannot do an inducement, which is giving away services for free or for other than fair market value. When I have a Medicare patient coming in, to be honest with you, and I do x-rays on my patient when clinically indicated, but the exam and the x-ray, if they have ChiroHealthUSA, it pays for that exam and x-ray. I tell them the $49 card will save you $80 today, and literally they say, what's to think about? You see? And so now with high deductibles, out-of-network or in-network, in-network, you got a $7,000 deductible, out-of-network, $20,000 deductible. Well, by all means, it's a difficulty for the patients, and you don't get paid by ChiroHealthUSA, but the patient pays you in that they are more compliant with your treatment program. And so ChiroHealthUSA, there are scripts here, and if you're a ChiroHealthUSA physician right now in office here, talk to the people, call them. Okay, when you call, you will get a real life person. But here is where you can actually have them fill out an affidavit that, remember, they don't have to go through their insurance. Now, you might say, well, they have Blue Cross and I'm, in the PPO. But if Blue Cross doesn't cover, if the patient elects to forego their insurance, then if you have them fill out a form, this affidavit, they can elect through HIPAA law that they wish not to go through their insurance, okay? So if the patient changes their mind, now they don't get that CHUSA discount. And just like a patient that only gets 10 manipulations per year, once they exceed those benefits, now they can go on ChiroHealthUSA for the rest of the year as well. Okay. Now, the last thing I want to get to, and I know we're coming down to a question and answer period. So if you have questions, feel free to ask here. But number one, do you have a family plan? Well, one of the most requested services with ChiroHealthUSA are the family plan. And you can have a family plan through ChiroHealthUSA. You can also cap the maximum amount that you want a patient to pay on their first visit. You see, it gives you the freedom to practice the way you want, to make sure, because ChiroHealthUSA has consultants, including me, that they can draw information from to make sure it's legal, and the doctor doesn't have to be bartering, well, if you do this, I'll do that with you. Now, the last part here, I wanted to talk to you. This actually came to my mind, and it's how a grocery store taught me value. This is not the picture of the grocery store, but it's just a canned picture. But I will tell you that in one of my local grocery stores that we have here, we have what's called a VIP card. And it's like a loyalty customer card. And, they have one price for an item, but if you are a loyalty or a VIP customer with this card and you scan the card and then they scan your groceries, you'll get a discounted price. And what was interesting with that at the grocery store here is every time that we go to the grocery store, not only is it printed up on the receipt, but they actually say, like here, you save $67.06 today with your card. Patients want to know how much they have saved with you as well. And this is something that we've instituted in my office, and I would highly recommend that you have a staff meeting and talk about this too. Because they don't say at the grocery store, you spent $143 on food that you shouldn't be eating anyway. No, donuts or whatever. No, I'm kidding. But they'll say, you saved $67.06. The person is thumping their chest and say, I saved $67.06. And so when you give that patient a receipt or when they're checking out and you're giving them, let them know, because they don't appreciate the savings with ChiroHealthUSA unless you tell them. Okay, with your ChiroHealthUSA card, you saved $86 today. And the patients, they're amazed. So keep that in mind and institute a policy in your office to reinforce the savings. And it should be a team effect. It's like the front desk, but also the doctor. The doctor will say, you're going to save this amount of money, or in the financial consultation, this amount of money here, okay? And so just to recap, number one, ChiroHealthUSA is not a time of service discount. You don't have to have a cash fee. It's a managed care fee, if you will, okay? Even if you say, I don't want to see Medicare patients, I want it to be all cash, well, how much of a discount do you give? And to make it legal, ChiroHealthUSA is perhaps the answer for you, okay? If a patient has a high deductible, services that they don't cover, even Medicare Part C, we've run into Humana policies where they don't have chiropractic coverage. So in those cases there, if they have no benefits under their Part C Medicare, you can then put them under the CHUSA plan, ChiroHealthUSA, okay? And so here, this is, if you will, another managed care program, okay? And so, looking at that here, number one, in consultation, can you help the patient? Patients come in and, they're not a dollar bill to us. I know, we're here to take care of people. And so let them know, yes, you are in the right place. I can help you. Okay, I've seen this before. I've treated, in my office, I've treated over 12,000 patients. I've seen hundreds, if not thousands, of what you have. I have very good success with it. Okay, every patient is different, and so I'm going to go ahead and this is what we're going to do today, and you let them know it typically, in this case here, may take 3 months to heal. What hours do you work? Our office hours are. Okay, and then how much? And again, just like with your report of findings, you go through the same, but it always ends off, they want to know how much is this going to cost me, you see? And when they ask how much, your answer is, according to your insurance company, our fee is our fee. You have one fee schedule, right? My fee is my fee except in a managed care program. Now, if they don't have coverage, have you heard of ChiroHealthUSA? And then inform them. Again, what I say in the script, if you will, is have you heard of ChiroHealthUSA? No, I haven't. Our office has been accredited with ChiroHealthUSA. What this allows me to do, I have to charge you what my fee is. But other people out there are getting the benefit of a Blue Cross PPO, an Aetna PPO. You don't have insurance, or your insurance has a huge deductible. So in order to help patients such as yourself, I actually became accredited with ChiroHealthUSA. And under our office policy, if you have ChiroHealthUSA, and by the way, the card is $49, but that's for you and all dependents. It's for your whole family, even that 30-year-old who's living in the basement. Okay, as long as they're dependent on you and they're living in your home, then they're covered. And now with our discount, ChiroHealthUSA, you get X amount. I can't set fees with you. Talk to ChiroHealthUSA about that. Okay. Hopefully I gave you a few tidbits, but times are tough. And like I said, stay strong at the beginning here, but keep in mind that the doctor should stay out of the financial consultation, but if the doctor is everything there, then do a legal discount, and it's a managed care discount. So you can't have a dual fee schedule except if it's a managed care discount. Okay. So hopefully I answered some questions there. I'm going to take any other questions that you may have written in. And Christy, if you have any questions, I'd be happy to answer those for our attendees today.
Thank you so much, Dr. Mario. We do have a couple of questions. How do you compete with local chiropractors who offer care at no cost to the patients? And then in parentheses it says deductibles and copay.
Well, okay, let me. This is a good one. Okay, and number one, if a chiropractor out there is treating patients for no charge or whatever your insurance pays, whatever your insurance pays is considered to be no out-of-pocket expense. That is illegal. Now, I can give you the ethics and compliance answer, which means that all insurances, including the government and Blue Cross and all, say if you know of illegal occurrences in another office, or if you're a patient of an illegal doctor, to turn them in. Okay? All right, so that's up to you, whichever, but I will tell you that keep in mind there's a perceived value. In other words, if I am giving, I don't know, whatever, let's say it's their birthday, and I am giving them a tube of BioFreeze, happy birthday, okay? Remember what I told you about the grocery store. You saved X amount of dollars, okay? Eventually, the patients will come to you not because of how much you charge, and some of those are Sally the shopper, and you might not even want those as patients. If everything is how much does it cost, and it's like having an employee who just says, how much are you going to pay me, and they go to the highest bidder. Sometimes those are not the best employees, okay? And hopefully I didn't ruffle any feathers there. But the key is if a patient says, this doctor doesn't charge anything, just say, yes, it's illegal. All right. There is a doctor in our city that has those kind of things there. And when you look them up, what you don't see is the doctor has had his license put on probation twice because of deceptive advertising, and that's a quote. So they may already be in trouble, and now these people are coming to you to look for that too. So it's perceived value, number one. Number two, we do it legal. Number three, this is the option you have with ChiroHealthUSA. Okay. Any other questions?
I do. What is a managed care discount?
A managed care discount is a PPO reduction, if you will. Now, ChiroHealthUSA is not a PPO. It's a medical discount plan, but it's discounted under managed care, which is under contract. Remember, you signed a contract with Medicare. We did, yes. You applied to Medicare. It's called the 855 form. You have the 855I, the 855R, and the 855B. That's the managed care in Medicare. Okay. In Blue Cross, you had to go credentialing through CAQH, and you are credentialed under Blue Cross. So those are PPO reductions. That's managed care. Under ChiroHealthUSA, you are under contract with ChiroHealthUSA, if you will. It doesn't cost you anything, but ChiroHealthUSA will advise you on the fee schedule the doctor chooses, and they are there to help you. But the patient buys that contract, if you will. Okay? And that's what makes it a managed care program.
Okay, our next question is if a patient has a Medicare replacement card, for example, Humana Medicare HMO, and we are out of network, can we offer ChiroHealthUSA for manipulations?
Well, number one, keep in mind that under Part C, and I'm going to rephrase your question, under Part C, the doctor is saying or the staff, we are out of network with Humana. Now, if you see Medicare patients, you are in network for that Part C. It's what you have to do, and I teach, if I come to a class around you, come to our class, because in class I go over this, that you want to call for their benefits. You want to find out, do they follow the Medicare fee schedule? Do they cover anything else other than manipulation? Do they allow the AT modifier and the ABN form? Most of them, by the way, do not honor the ABN form. But if that patient has benefits, in other words, we cover chiropractic, you're in network because you're a Medicare doctor. Medicare Part C is still Medicare, okay? It's just now it's a private company. But if they say we don't have chiropractic benefits under this Humana, then in my opinion here, and I'm on the Medicare Advisory Committee, you can give them because they don't have chiropractic benefits under their Humana, now you can do the ChiroHealthUSA discount with them. So even if they have a $60 copay, if they have that benefit, then they get the Medicare rate. But if they have no benefits, then you can give them the ChiroHealthUSA discount. Anything else?
Awesome. Okay, so I do have one more question. This one is, our office is having issues getting EMS 998213 when it is performed with a 98940 series on the same date of service with Blue Cross Blue Shield Oklahoma. We use the 25 modifier for the code, and Blue Cross Blue Shield says it cannot be paid separately because the 98940 series, which they say contains evaluation findings, which is medical necessity. Why or how can we get reimbursed for exam and manipulation on the same date of service with this insurance company, especially when necessary the same day?
Well, Blue Cross Oklahoma is also Blue Cross Illinois, which is Blue Cross Texas, and Blue Cross, I believe, New Mexico, okay? And their policy is they have bundle together the manipulation and the examination. And I totally understand if you use the 25 modifier, you should be paid for both. That's my opinion. But what they continue to say is that they are not separate, but they are bundled together. In Illinois, through our state association, we have fought that, and we haven't come up with any solution yet. I wish I could tell you, but keep in mind that, and this is my opinion, okay, this is just my opinion. Number one, if you are advising the patient, then, it's like you would tell the patient they don't pay for the exam. Okay, let me answer this way, okay? Buy one, get one free. Okay, which one do you get free? The one that's cheaper, right? No, not in Blue Cross. The one that's most expensive, they take that off, okay? So what I do, and this is my opinion, I might get in trouble for this, but what I do is the patient is there for an evaluation, examination. If I happen to adjust one or two segments during that exam, I then choose, I don't charge for the manipulation because it is bundled in with the exam, you see? And so I charge for the exam. Now I know that's not right, but until, and maybe it'll take some legal action, but talk with your state association, talk with your congressman, talk with the insurance commissioner, but right now they're holding fast on this, and this is not just in Oklahoma, it's all over. And so, the examination, X amount of dollars, which I'm sure it costs more than the manipulation, and obviously you're not going to do that every visit, but if they're there for an exam or a re-exam, charge for that exam or re-exam, okay? But I hear your frustration. I'm frustrated too, but now I say, okay, the primary reason for the patient being here today is as a new patient, exam, and x-ray, whatever. A re-exam, they're here for a re-evaluation, and so I'm going to do a re-exam, and I'm going to charge for that re-exam. So charge for it, okay? But then I don't charge for the manipulation, okay? I hear you. I know. You can argue. We can talk and talk, but Blue Cross, no matter what, is not going to change. So you appeal it, but it's not going to work.
I have to say that I would have been more surprised if that question didn't come up today. Because we're hearing it so much. What is a good percentage or a discount from your original fees?
I cannot answer that, but when you talk to ChiroHealthUSA, they can counsel that. I do not want to set fees, and that would be collusion. We can't do that. So I would say call if you're not a provider. We have been provider in our office now. I think it's going on 5 years. We have hundreds of patients on ChiroHealthUSA, not because we're pushing it or get some incentive. It's because people have lousy insurance. So call ChiroHealthUSA, tell them, I've heard Mario's webinar, and I want to talk to somebody on how we can implement this into my office, okay? They will work with you with your fee schedule, and they will give you something that you, the staff, and the doctor are comfortable with, okay?
And our final question, do you know why is Zurich denying 97014? They claim some sort of CMS reason. I don't have problems with other payers paying for this code.
97140, which is trigger point therapy, and I would, number one, either the 59 or the X subset modifiers. Most commonly, we're going to use X, S as in Sam. So number one, and Blue Cross, the person that asked about that Blue Cross problem, we're having the same problem with Blue Cross there too with trigger point therapy. Keep in mind that under medically unlikely edits, MUEs, that you cannot do trigger point therapy to the same region, not the muscle, the region, as manipulation. And so if you're charging a 98941, which is up to 4 regions, and then you're doing trigger point therapy, even if you are using the 59 or excess modifier, you're saying I did it to a different region. There's only 5. They're going to deny it, and then you got to fight it. But that's why is that is part of those edits there. And just like we talked about the exam and manipulation, those edits too through Blue Cross. And so I'm not sure, what your situation is, but it's probably most likely that. But number one, make sure that and if you want to send me an email, my email I'll have up here right now, and it's doc@askmario. And I would tell you, number one, make sure you're using the right modifier. Number two, the correct diagnosis pointing, okay? And but even if you're doing it right, it still may be denied because of this screw up in their software.
And I'm going to ask this one question, even though I already said it, but this is a great question, and it just popped up a couple of times for this particular issue that a couple of states are having with the manipulation code and the exam code. They're asking, do you include in your notes that you did the manipulation?
I do, but I do because of risk management and everything. But keep in mind, I didn't bundle them together. The insurance company did. They said that they are the same thing. Well, good. So what's the patient there for? They're there for the exam. I spend 20 minutes doing an exam. I adjust 2 segments. You can't take the exam away, okay? Now, if they want to throw me in jail for that, fine. But the key is that's my argument, okay? And so I'm trying to follow the guidelines through the insurance company, and they don't have the greatest guidelines. So yes, you write down what you did manipulation on, but preferably we don't do exam and manipulation the same day for those policies.
All right. I want to thank everyone. I knew this was going to be a popular webinar, and anytime we have Dr. Mario on, we get so many questions. So if you think of a question like me, 30 minutes after our webinar, I'll think of a question. I'm like, why didn't I ask that? Feel free to email me. You can just hit reply to one of the emails that we sent you to remind you about the webinar today, and I will make sure it gets to Dr. Mario, or you can use his email address that he has kindly shared with you, doc@askmario.com, and send that over to him so that he can answer. If you have not already gone and liked his Facebook page, I am telling you, you are missing out, because anytime there's a change or an update or something that you need to know in your practice, that is the first place that it's going to be posted. I check every single notification that I get when Dr. Mario posts on his Facebook page, because there is information that I need, that the doctors that I work with need, that Dr. Foxworth's practice needs. And so incredible information. Everything is so useful. So I really encourage you to do that. Check out his website, askmario.com. And if you are going to be in one of those great states like New York in the next couple of weeks where Dr. Mario is speaking live and in person, do not miss his class. Hands down, right before the webinar today, you'll know I love to gush about my speakers, but here's the thing. I have known Dr. Fucinari for almost 8 years, and one of the most amazing things that I can say is that I've learned so much from him, but I learned so much when I have the opportunity to hear him speak live and in person, because I get more time with him, 2, 4, 6, 8 hours to hear from him. He breaks everything down so that it's easy to understand, easy to remember for you and your team that you're working with. But more than that, when you're talking about something like Medicare or compliance, it can be mind-numbing, to say the least. But he is very entertaining. He's so funny. He has great stories, and he has great ways to really connect with you so you don't forget this really important stuff, so that you can run a very efficient and compliant practice, make sure you're getting paid, and increase your profitability, because bottom line is we want you to all be successful. And that's what he's really, really great at, is being able to share that information. And, he's been in practice for all this time, so he knows what you're going through, and he's facing, like you said, the same things are going on in Illinois. So he really does know where you're coming from. So really, if you have that opportunity to see him live and in person, check him out. If he's not speaking in your state, you email me, and I will figure out and work it out with your state association that we can have him come and speak in your state, because he is absolutely amazing. Later this week, we don't always do 2 webinars in 1 week, but we are sponsoring a webinar with the Foundation for Chiropractic Progress presented by Dr. Scott Munsterman on the history of the opioid epidemic. How did we get here? And then what can we do with this information, and how can we help our communities? Next week, we have my good friend Dr. Stephen Wanager out of Georgia, talking to us about motor control exercises, and the opportunity to help our patients with low back pain and wellness. In October, we're kicking it off with Dr. Cindy Howard, another Illinois provider on pre and post concussion nutrition. And then we'll be following up the following week with, is your office prepared for an emergency or a disaster? You know, at this time right now across the country, many of our providers are having to deal with hurricanes. You know, and the same thing happened last year. And what is your emergency preparedness plan? And if you don't have one, this is going to be a great webinar for you and your team to make sure you have one of those in place, because things happen, natural disasters happen, be prepared. Dr. Mario, thank you so much for being here today. And again, I'm so excited because I'm 3 weeks away from getting to see you and your lovely wife, Miss Jenny, in New York, and I'm very, very excited about it.
Thank you. Thank you, everybody. Thanks, Christy. Take care.
All right. Bye, everyone. Be on the lookout. In the next 10 minutes, we'll send you the link to the webinar recording. This is going to be one of those webinars you're going to want to go back, listen to. If you are the doctor, share this information with your team. They need it. They want it. It's going to make them better and your practice better for it. Y'all have an amazing rest of your day, a fabulous week, and I'll see y'all next week. Bye-bye, everyone.
Bye-bye.
Dr. Maria?